Surgeons have successfully carried out the UK's first womb transplant, giving hope to dozens of women who are currently unable to have a baby. This kind of life-changing surgery could help women born without a womb and those who lose that organ to cancer or other conditions, as our medical editor Fergus Walsh reports.
No, I want you to record these guys.
A UK first as surgeons transplant a womb into a 34-year-old woman donated by her 40-year-old sister. The surgery in next-door operating theatres at the Churchill Hospital in Oxford in February lasted around 17 hours.
It was an amazing day, absolutely amazing.
These two surgeons led a team of more than 30. They recall the reaction of the younger sister when she came round.
She was absolutely over the moon. There were a lot of tears, a lot of emotion. She was very, very happy. And the donor probably was even happier because she had some time to recover from the anesthesia. So it was a very joyous moment for everybody.
The recipient was born without a normal uterus, but with functioning ovaries. With her husband, she already has 8 embryos in storage and could go on to have 2 pregnancies, after which her sister's womb will be removed so she can stop taking powerful drugs which prevent her body rejecting the transplant.
So she's doing really, really well. She has started having menstrual periods, and that means her prospects of having a baby are very high. She needs to stay on immunosuppressive therapy and to be closely monitored, and we hope to be doing an embryo transfer in the autumn.
In 2014, a woman in Sweden became the first to have a baby after a womb transplant. Since then, around 100 transplants have been performed worldwide, with 50 babies born. The surgical team here is funded by a charity, Womb Transplant UK, and has permission to carry out the procedure with both live and deceased donors. There are a dozen women with embryos in storage or who are going through IVF who are hoping for a womb transplant. For now, the charity has funding for just 3 more operations.
I'm really excited, yeah, it's nice to feel that it's finally happening.
And the demand here could be significant. Around 1 in 5,000 women is born without a functioning womb, but many more, like Lydia, lose theirs due to cancer. She says a transplant would feel miraculous.
Since getting diagnosed with cancer and the hysterectomy, the infertility was such a huge part of that, and you grieve, you really do. Hopefully being on the waiting list for a transplant would mean everything. Being able to carry my own child and have that experience of feeling it, being able to breastfeed and being able to have a newborn baby at least once.
The charity, Womb Transplant UK, has paid £25,000 to cover NHS costs.
Say hi.
And all the staff involved gave their time for free. But they will need a big injection of funds if many more women are to benefit. Fergus Walsh, BBC News.